Assalamualaikum. I, Dr. MUHMMAD AKRAM, Associate Professor, Department of History Medicine, Government College, University, FAISALABAD. I will discuss Cobalt. It is an integral part of vitamin B12. Copper is beneficial in the treatment of anemia. Excess of cobalt is very toxic. It can cause hyperplasia of the bone marrow due to increased erythropoietin synthesis, which causes polycythemia. It can also produce cardiomyopathies and nerve deafness. It is also entirely eliminated by the kidneys. Now I will discuss calcium. Normal plasma calcium level is 8.5 to 10.5 milligram percent. More than 99% of calcium in the body is present in bones as its phosphate and carbonate. Bone calcium is constantly exchanged with the calcium of the intestinal fluid, and this process is regulated by parathormone, vitamin D, and also by calcitonin. Plasma or serum calcium, non-diffusible. This fraction cannot be dialyzed out. Diffusible, this fraction can be dialyzed out. It has two subfraction ionized calcium. This is the physiological active unbound form of calcium. It performs critical function in muscle contraction, nerve impulse, transmission, transport, and transmission of signals across membrane. It is increased in hyperthyroidism and decreased in hypothyroidism. Complexed calcium. This calcium is in complex form with plasma anions such as citrate and phosphate. It is in the crystal form and is present in bones and teeth, forming the cement that contributes to the physical strength of these structures. Absorptions. Calcium is absorbed in an organic form. It is absorbed mostly in the proximal parts of the small intestine by an active transport mechanism. In the distal small intestine, calcium is absorbed by passive or facilitated diffusion. Calcium absorption is increased with increased intake of calcium. Vitamin D, parathyroid hormone, bile salts, presence of protein in diet, and low calcium stores in the body. Impairment in fatty acid absorption interferes with the absorption of calcium. In old age, calcium absorption is decreased. Function of calcium takes parts in the development of bones and teeth, helps in blood coagulations, controls nerve excitability, serves as cofactors and activator of certain enzymes required for contraction of muscle, including heart muscles, maintains the integrity of calcium capillary walls, helps in the release of catecholamines from the adrenal medulla. Calcium is required by certain hormones for their action, adrenaline to increase glycogenolysis excretion. Unabsorbed calcium is lost in feces. Excessive sweating also results in an appreciable loss of body calcium. Thank you very much.